Hello, my name is Eleanor and I'm going to tell you about the research I conducted for my Masters under the supervision of Dr. Rosemary Godbold. What matters most in care and decision making for children with complex needs, mothers' perspectives. We know that there is an increasing number of children and young people with complex needs, but how do we define who they are? So for my research, I created a cohort definition, which identified 3 characteristics of complexity, those being the involvement of multiple agencies, health which is prone to rapid change, and a high burden of daily care, which is carried out mostly by parents in the home. The kind of health needs that these children have can include life-limiting conditions, chronic disabilities which require complex care regimes in order to maintain stability, and complex life-threatening conditions which children may survive. My overlying research aim was to explore the experience of parents caring for children with complex needs. Within this, I wanted to find out about the impact on family life, what care and services work well and what could be improved, how healthcare decisions are made, both in terms of day-to-day decision-making and advanced care planning, and what matters most. I really wanted to give parents a voice and to hear perspectives about both acute and community care. My research was a qualitative design using a single phase. My interviews were conducted over the telephone using a topic guide. My interview style was semi-structured, using active listening and reflection to ensure meaning. I had a strict inclusion and exclusion criteria. I made amendments in line with COVID-19, and I really wanted to minimise the burden of participation because we know that parents of children with complex needs are busy and exhausted. And finally, I really wanted my findings to be applicable to practice, to make service improvements. In order to collect data, I needed Health Research Authority approval and approval from my local NHS site. Participants were nominated by the Community Children's Nursing Team, and 7 mothers volunteered and took part. Telephone interviews lasted between 1 and 1.5 hours, and at the end of these, mothers had a chance to tell me what it was like taking part, and I gave them aftercare information. The kind of health needs that their children had included neurodegenerative conditions and complex organ failure, children who were technology dependent. Some of these children had continuing healthcare team provision, and also children with high-risk malignancy and those having innovative treatments. I used Braun and Clark's 6-phase thematic analysis. So interviews were transcribed anonymously, and then they were coded. Through constant review and reflection, codes were turned into themes, and my university supervisor independently analysed the interviews to ensure trustworthiness of my findings. COVID-19 was confirmed as a theme in its own right, and then key quotations were produced for the 7 themes that I'd identified across all of the interviews. This is a whistle-stop tour of my results. So I identified 7 themes, the first of which was cherishing normality. Mothers were very motivated to have their children at home if possible, which involved taking on a lot of care tasks. They wanted their children to have quality of life and time as a family. However, health needs were very unpredictable. One mother said, "You live your life on this tightrope of can we go, can we not go?" Navigating the system. The logistics are immense for families. One mother said, "There's so many different teams and hospitals, and it's a lot of chasing on our part and liaising between everybody." Being proactive. It was important for mothers to know that they were proactive and exploring all options, and also they appreciated when professionals were proactive on behalf of their children. One mother said, "I needed to feel confident that I had come to peace with each of the decisions because I needed to answer to myself and not regret." Meaningful connections were really important, a sense of continuity and relationship with a trusted professional. One mother said about her child's consultant, "He uses my name regularly, so you're still you. For those few moments, we are the ones that matter." Meaningful connections also applied to relationships between parents in similar situations, so a sense of peer support. Another theme was beginner to expert and back again. We know that mothers and parental caregivers accumulate an enormous amount of expertise about their children and develop lots of skills and knowledge. But my findings showed that when a child is acutely unwell or in a new setting, parents can feel like novices again. One mother said, each time a new phase starts, that same feeling of being a beginner again, with some overarching themes. They're not any child, they're my child. This theme was really about the value of a child as a person in their own right, about their self-worth, and about issues to do with prejudice around disability and access to treatment. One mother said, he just assumed Jess was a no-hoper because she was on a sling, thinking, why are we bothering? Well, because she is my daughter, and she's lovely, and she deserves the best. And finally, COVID-19 is a theme in its own right. For some families, there were benefits to lockdown. One mother said, it's been a new thing since lockdown. It's taken 13 years, but we actually got a wheelchair that fits him, and we take him into the garden round the block. It was amazing. So the logistics of care simplified for some families, and for this youngster, he got out of his house for one of the first times. For other families, my findings actually gave qualitative evidence to some of the quantitative data that's emerging about families feeling isolated and left behind. For one mother, she said, we haven't had any real kind of progression or anything. Nobody's been able to really make plans because they haven't seen her. And this was particularly difficult for families that were new into a situation or who there were lots of acute issues going on. Strengths and limitations of my study. Obviously, it was a small study on a single site, and there was a narrow demographic. I didn't capture the voice of children and young people or the voice of fathers. However, the voice of mothers is really important to get evidence on. My findings were data-driven and supervision ensured trustworthiness. Mothers reported a therapeutic interview experience, and because I'm working clinically, it's a benefit that I'm actually invested in ensuring that recommendations for practice are implemented. Findings are transferable, and as I said, because the interviews took part after the first England lockdown last year, the chance to get evidence around COVID-19 was timely. Implications for practice. So mothers identified that they need integrated, flexible and individualised care for their children. They do not fit one box. It's really beneficial if professionals have a holistic view of the child and family, a sense of them as a person, and the bigger picture, everything else that they might be dealing with at home. Mothers value guidance and advocacy, and trust, hope and truth. Early advanced care planning can be really beneficial to identify shared goals and values and to ensure emergency healthcare plans which reassure access to treatment. Mothers need communication and consistency across time, so not just for short episodes of care, but in the long term. A mother's own sense of identity and purpose is really important, and they need increased support at times of vulnerability. So for example, new phases of care or during acute episodes. And it's really important that mothers have the chance to explore decisions and ensure that there are no regrets going forward. In conclusion, it's really beneficial to have supervised research for clinical practitioners. This study has given clear implications for practice and local service developments that we can implement. It's also generated new ideas about how we get feedback from service users and involve them in services. Engaging children and young people in research is really important, but there are ethical issues which are too many to go into in this short presentation. My study found information about support, resilience building and guidance, which mothers of children with complex needs need, and some of which they build through experience, and also highlighted how using COVID-19 service adaptations can benefit isolated populations. Very few key references, and finally a chance for me to say thank you very much, Martin House Research Centre. Your 2018 study inspired the What Matters Most focus of my research, and it's a pleasure to present my findings to you today.